I'm going to ask you something that most dentists think they know the answer to, but 9 times out of 10, they're wrong. Is your hygiene department a cost center or a cash machine? Because for too many practices, hygiene is just an inefficient department that's really a loss leader or maybe break even at best. In fact, on average, 75% of restorative treatment is diagnosed in the hygiene chair, but less than 50% of it is ever actually accepted and scheduled. That's extremely inefficient. And here's the truth. A healthy hygiene department is the engine to your entire practice. It drives production, patient retention, case acceptance, which is really going to be causing profitability. Because if you're doing all of that work, getting patients in, doing their exams, diagnosing cases, but not closing it, what you're really leaving on the table is your profit. So if hygiene's just a cleaning or making sure that your patients are coming in for their biannual, what my insurance covers cleaning, you're leaving some serious money and, more importantly, patient health on the table. Today, we're going to be flipping the script on hygiene and show you how to turn it into the single most valuable system in your practice, or really a hygiene-driven practice. Welcome back to the Next Level Practice podcast, where we don't just talk about the business side of dentistry, we fix it. I'm your host, CEO of Next Level Practice, Kelly Dahmer, and today we're tackling the most overlooked, underleveraged, unappreciated department in your practice, hygiene. Now, you might be thinking, it's just hygiene. It's not where the big money is. That's not necessarily true though. Maximizing your hygiene department is the fastest way to recession-proof your practice. I want to introduce you to a doctor, Dr. Haggett. He was running a solid practice. The schedule was full. He really was a master at creating beautiful restorative work, and he thought his hygiene department was high performing. I asked him, I said, 30% is our benchmark for the amount of production that your hygiene department should contribute annually. Are you there? He said yes. When we took a deeper look, it was actually at 18%. His hygiene department was stuck in neutral. Here was the confusing part though. He had great hygienists, but there was really no system in place, no system for reappoint, no production goals, no real connection to case acceptance. And when we stepped in, we helped him transform hygiene from the maintenance task to truly a revenue driving, patient transforming department. Within 4 months, his hygiene production had doubled and his restorative schedule started filling itself. This is called working smarter, not harder. So let's talk about how that happened and how you can do the same. Step 1, why most hygiene departments are silently sabotaging your growth. 2, how to transform hygiene into the most powerful case acceptance tool in your practice. And 3, the 3 hygiene shifts that can boost production without adding more new patients. A lot of times our doctors think, oh, in order for me to grow, I need to add more new patients. Typically, there's a lot of untapped potential and it starts in your hygiene department. If you think hygiene is just for maintenance, this episode will completely rewire the way you see your schedule. Remember, busy does not equal productive. And here's the deal. Hygiene isn't just about cleanings. It's about relationships. It's about education, preventative care, and truly uncovering deeper health opportunities. So I want to dig deeper into Dr. H's story. He did have 3 hygienists. They were doing great clinical work, but they weren't connected to the bigger picture. It was always, I'm busy, barely have enough time to do my cleanings. I can't educate my patients. There was also no real reactivation system, no discussion of fluoride or perio. There was no handoff to restorative care, no patient education that connected the dots. And as a result, everything was left to the doctor to really do the heavy lifting and produce coming out of the doctor's chair. Here's how we helped him implement 3 key shifts to change how things were happening in his practice. Number 1, do you have a patient education system? There's many different ones out there. We really love having a tangible education tool that your team can co-diagnose and educate from, even starting at your front team, right? We want them to be educating with what we call a healthy mouth baseline. It's the standard of care for your practice. This helps with patient education, co-diagnosis. Also, if you have multiple associates, it takes away the standard of care from a provider level and really brings it to a practice level. We give every hygienist a consistent script and protocol. In Dr. H's office, we sat down with the hygiene team and we created their standard of care health mouth baseline that they agreed on. Then we created a script and protocol to evaluate 6 areas areas of oral health. That way, patients understood where they stood and could see the need for treatment before it was ever presented. It's like a report card, really. You can check off the areas that need attention, and they get to see where they're healthy and where they're not. Number 2, tie hygiene to your treatment pipeline. We trained as hygienists on how to identify potential restorative needs, co-diagnose confidently, and then seamlessly hand off to the financial freedom fighter in the practice so that the patient was already saying yes before they got to that part of the practice. Step 3, since there hadn't been a system in place for reappoints in hygiene, we did put in a reactivation machine for hygiene. There was a lot of unscheduled active patients sitting there. So we built a reactivation system that reached out to overdue patients, filled the hygiene schedule, and connected them back to their care without needing to spend another dime on marketing. Within months, his hygiene team was producing like doctors, and his case acceptance rate skyrocketed. As a result, more profit in the practice, more health for his patients. So what are the 3 things that you can do today to start seeing your hygiene department increase? 1, install that Healthy Mouth Baseline standard of care. Create a consistent system for measuring and sharing oral health statuses. When patients see the truth, then they say yes to what they need. The second thing that you can do is train your hygienists as co-diagnosticians. Give your hygiene team the tools, language, confidence to support treatment, not just clean teeth. We really want to shift them from being gum gardeners to patient health advocates. Hygiene is your front line for case acceptance. The third thing that you can do right now, take a look at those unscheduled active patients and build a reactivation machine. Don't let overdue patients slip away. We don't want you to be on this new patient treadmill of patients coming in through the front door, leaving out the back door. Automate your outreach and track it weekly. Hygiene reactivation is actually one of the fastest ways to boost your production, and no new marketing is required. Okay, let's recap what we covered today. First things first, hygiene isn't a cost center, it's your untapped gold mine. Our benchmark again is 30% of your practice production coming out of your hygiene department. With the right structure, your hygienist can drive production and drive case acceptance. The last thing we covered is most practices don't need more new patients. They need to reactivate the ones they already have. If you're curious and getting specific on your hygiene department and what percentage is actually producing, we'll meet with you to actually calculate that for you. You can click the link in the show notes as well and book a strategy session with our team, and we'll map it out with you together. In this episode, we opened your eyes to the power of hygiene. Send this to your hygienist or to your whole team. I'm Kelly Dahmer, and this is the Next Level Practice podcast. See you next time.